My name is Joseph Atakunda, and I am the coordinator of Heartsounds Uganda, a mental health champion group whereby we service users come together to offer each other peer support. I got ill in 1998, and I started with a depression episode. And I was treated with electroconvulsional therapy, that is ECT, whereby a certain amount of electrical current is passed through your brain. And they say that is one of the most effective ways for severe depression, because I was suicidal. I wanted to commit suicide. I thought that it was the end of the world. Then afterwards, when I went back home after that treatment, I went into a manic phase whereby I became so excited. I was acting a play, and I started forcing people off the street to come and see my play, and people knew that there was something wrong. Then that's when I was diagnosed with bipolar, because I had shown both poles, the depression and the mania. So I was treated, and I was put on an injection called Haldo, which is long acting, and I'm given an injection every month. Ever since then, I've been taking that injection. We say we are in recovery, but we still take medication. Recovery doesn't mean that you stop taking medication. You can still take the medication, but you're trying to live a normal life like other people. You've seen my family and children and wife around. I'm just like anybody else, and I'm trying to survive and trying to be functional. That is what recovery is all about, even if you're still taking your medication. So I was reading books. One of the things that has helped me a lot in my recovery is reading books. And one of the books I read was telling me, stop asking why questions. Why did I suffer? Why me? Start asking questions like, what can I do about it? How can I help myself and help others? So I started asking those questions, and that is when I got an episode and went to hospital. Then when I went back on the job, I found that I had been demoted. That they were trying to reason that the work is too much for me as somebody who is disabled by psychosocial illness. They needed to reduce my responsibility. But then I decided to resign on spot and start Heartsounds Uganda. And when I was in hospital during that episode, I recruited the first members. When I was in hospital, I recruited the first members, and the group started off, and it has been building itself, forging ahead, like I told you. It has been building itself up to where you see it now. Ladies and gentlemen, I thank you very much for viewing me, and let us work together. We, the service users, the service providers, and the public at large, to try and get lasting solutions to mental illness. Let us stop the stigma. Let us know that this is just an illness like any other illness, and it can affect anybody. You never know, anytime it is you, it is your child, it is your if we keep on hiding, because the normal way is to hide, nobody should know. Now when you hide, the stigma increases. When it increases, you hide more. When you hide more, it increases. That is a vicious circle. We just have to come out and speak, like the AIDS people. They came out and they spoke, and today people are interacting with AIDS people without any problem. Now if I tell you that I have a mental health problem, I usually go for karaoke, and I sing. One day I told them, and they withdrew a bit. But afterwards they realized that we have been with this man for a long time. He has never harmed anybody. He just sings his songs and makes fun. Then they started coming back. Now we don't have to fear this initial withdrawing. That is natural. And nobody is bad that they are trying to stigmatize you at. It is just natural. They were brought up that way. But we just have to face it head on. And those of you who can help us get funding. We want to have a complex where we even have a swimming pool, where we even have resting rooms, whereby we have counseling rooms, and resident psychologists. Anytime you just ask a psychologist, I want to talk to you, and you talk to the psychologist. And we are not only doing this in Kampala, we want to spread out throughout the whole country. And if we live long, we shall spread out the whole continent and the world at large. Thank you very much.